Okay, so the last time we were in your pharmacy, another thing we kind of noticed, which was neat, is you've got a little testing facility where you're in the front of the store and you've kind of got a partition off, a cubicle looking, that you're for diabetes patients. You're checking weight and other stats. Kind of walk our listeners through that.
Yeah. We were in a pilot program called PMAP, P-MAPP, and it's basically a point of care proof of concept, I guess, for lack of better terms, program where we're trying to see if we can do A1C, serum creatinine, lipids, all in a finger prick type machine. It's to prove that the machine works and that the results are accurate with the serum levels that the patients get every 3 months. So we compare them, and then we track their progress and see if we can have A1C drop throughout a year at a time, based on adherence and changing therapies and using ADA guidelines and things like that. So it's a pretty neat concept. The equipment itself is pretty cool because it's unique. We haven't had anything like it before. It's also sponsored by FDA as well. It's a partnership, so everything's free to the patient.
Nice.
Yeah, it's very cool. And basically, there is some criteria, inclusion/exclusion criteria. Like the patient cannot be on mealtime insulin, so that's a challenge, filtering out our patients on mealtime insulin. But it's actually been a pretty easy recruitment process.
So
we're in month 5 right now.
Is that an FDA study? Are they studying to prove out the device?
Yeah, so that's exactly right. Yeah, so the device is seeking FDA approval.
Okay.
So in order for them to get FDA approval, they need to prove that it will work, and and they're using independent pharmacies. It's actually through our buying group that set it up. So there's probably, I think it's like 60, 70 stores throughout the country doing this. It's not just us.
And who's your buying group again? That was CPA?
APCI.
APCI, okay. Huh. Oh, how is it going? Looks like it's successful?
Yeah, so far it's been successful. We have 2 machines actually, because we have one in our lobby, and then we also run an indigent clinic. So we have partnered with a free clinic in town, which we run the pharmacy. There's not a pharmacy there, but we run clinical interventions there, right, basically on Fridays. My residents there on Fridays and myself sometimes. So we're recruiting people at both locations. So it's been going really well because it's a natural fit there. Those patients don't have any money, so a free program to track A1C, weights, cholesterol, and all that works out fantastic. And then the medical director there can, make adjustments based on our results instead of, they can't pay $80 to $100 for lab, a true, lab draw.
Right. So where are you recording the data? Is it just in the machine and being sent somewhere? Or are you recording that in Pioneer as well?
So we record all of our care plans from our clinic are in Pioneer. So any intervention we have at our clinic is in Pioneer, and then we submit them to the clinic every week. So because it's a grant, we get paid to do it. We've received $40,000 in grant money already based on what we're trying to do. So in order for us to justify our grant, we use the care plan module. We create our own template, and we use that recurring. And then we use the labs tab to now add the labs tab in Pioneer to add the labs for this program. This program also has its own portal that we have to plug in the values to for them.
That's awesome.
And how is it? So it's doing well. You're lowering A1Cs. It's doing better than some of the other things you're doing.
Yeah, so far it's really good. So it's got a lot of motivational intervention, which is a huge push right now. So not every time they come see us, it's a lab draw or discussion. It's basically how do we curb your behavior to become more adherent. So far it's been really well. The patients at the clinic have really embraced it because they're getting free health care, right? They're getting free health care from the provider. Now they're getting a pharmacist they meet with, and now they're getting the lab as well or something like it. So it's really been great for them. And we've kept a lot of patients out of the hospital. And that's how our indigent clinic gets paid, is preventing hospitalizations and having interventions with patients that are uninsured.
So what would you say is your best patient success story?
Yeah, so we had a gentleman come in that was on, the previous provider at the clinic basically had put him on every single diabetes medication, every class, SGLT2, GLP-1, mealtime insulin, basal, everything. And the guys came in and was like, I have like 6 injections a day. I'm on 11 other oral medications. He's like, yeah, I'm just not going to do it. I'm like, dude, I don't blame you. I wouldn't do it either. So what was interesting is that we eliminated a lot. We said, let's just start over, and use our methods here and say, okay, your fasting glucose is like 400, which is terrible, but he probably lives in the 300 to 400s and doesn't notice. So we just kind of cut everything back, added just 2 treatments, put him into the program, the PMAP program, and now the guy's lost about 40 pounds over 3 months, and his A1C has gone from like it was probably 12, and now he's at like 8.5. I think was the last finger stick he did. So, and the guy now he comes to the store. He was not really ambulatory before. He's like the head of his HOA now, so he's actually trying to get his life back together too. And a lot of these people, they've suffered a lot, and they're in a situation, and they're not adherent for a reason. It's not because they don't want to.
It'd be an interesting conversation with him and Kathy Campbell and Deanne Mullins. Are you familiar with any of those two?
I know Deanne very well. She was a CPSN luminary with me when we started CPSN here in Florida. So I know Deanne very well.
She has a complete diabetes class in the back of her pharmacy. And
yeah, she's got it figured out. And that's the reason why I'm sitting in this unit, because this unit I'm renting out is going to be our diabetes clinic. I'm going to get my CDE. I just finished a class about a month ago. So we're going to start our own diabetes center here.
Got it. So you're basically going to start the full gamut of group education, personal education. Nice. Medicare
billing. Right. I have a doctor in town that has nurse practitioners. We're going to bring a lot of different types of people, providers into this piece.
Very cool.
So, I mean, I guess this all kind of goes back to your 90% out of the facility, but those relationships with the nurse practitioners you had already that you're kind of leveraging for this?
Yeah, I mean, our growth trajectory is 100% based on me going out talking to managed care providers, the doctors that provide the managed care, and work from DaVita and the insurance. It's all managed care, Medicare now. Fee for service is kind of a thing in the past. So I meet with these doctors that go to patients' homes because that's their model. They're doctors at home.
Oh, wow.
So they send me all their referrals because they're going to the home anyway. So the patient can't get out or doesn't want to go see their doctor. They don't want to go see their doctor. They're not going to go see their pharmacy. So that's how it started 3 years ago, is me partnering with about 4 or 5 provider groups in our area that just see patients at home. And then the other provider groups, like the big ones, the hospital groups, the DaVitas, the Optums, they're like, hey, this patient came in with your blister packaging, your adherence packs, and they're transferring from another provider. Like, we want to do this too. So, and then I have 2 groups, well, not 2 groups, a lot more, but 2 of them now have just called, they tell me I do all the HEDIS measures for them. So they're hitting their bonuses at like 99%, 95, 99%. So then now the head of Optum's like, Eric, how did you get my office, which is historically non-adherent, all their patients to hit their bonus at the highest level? So again, that goes back to what we talked about before. That's why they don't care about the mail order as much as they care about adherence.
Right. All the way up, because that's star ratings and
mm-hmm.
Yeah.
I mean, adherence drives huge number of bonuses at their HEDIS and MIPS and macro.
It's massive.